So it's gonna be a beautiful day today. We're gonna be talking about depression and versus sadness. Okay, I'll ask Sir Jack. Sir Jack, what's for you? Like, what is the difference between sadness and depression?
Sadness is more of a short-term issue. Depression is more of a long-term issue. So, for example, when you have the death of a loved one, obviously there's a great amount of sadness that goes along with that. But if that lasts for a significant period of time, that sadness then becomes a depression.
Okay.
And much more difficult for a person to climb out of.
And sadness, it's a normal, normal reaction. So depression, it's not normal, it's a mental health issue, And we're gonna be talking about that, especially right now, holiday season. A lot of people are happy, but then there are also a lot of people that are very sad. Yeah. So do you remember when you were sad, Sir Jack?
Yes, absolutely.
I remember when my dad died, I was very sad.
Oh, yeah.
So that time I was just sleeping, I was crying, I didn't eat that much. So basically depression is like that. So it's a persistently depressed mood or sadness and loss of interest in activities. Like we usually want to go outside, and that time I didn't want to go outside. We would usually eat at a restaurant, and then I didn't want to eat. So it was like that. That's how depression is. And then it causes impairment in our daily life activities. Okay, so sometimes you don't want to go to school anymore because you're depressed. You don't want to go to work anymore, right?
Yeah.
Or you don't want to talk to people. So that's how it can affect our life, okay? So the symptoms of depression can be tearfulness, emptiness, or hopelessness. Like, I don't think there's something into life right now. So maririnig mo yung mga tao na yan na parang wala nang pag-asa yung buhay nila. And then they would just tear up out of nowhere. Magugulat ka na lang. But also, that's the extreme part of depression. Another extreme part of depression is angry outburst. Magugulat ka na lang, galit na sila.
What?
Okay? And they are easily irritated or frustrated. So on the other spectrum, they're always crying. And on the other spectrum, they're also very angry, irritated, and frustrated. They also have lost interest or pleasure. Like what I said, sometimes they would enjoy gardening. They don't enjoy it anymore. They would enjoy exercising, eating. So yan. So Janice Anama said, Anama Buraga depression, it sucks. Yeah. So I think for all of you, you can put it in the thread. Like if you have depression, so we can help you or what. But I hope this FB Live will help you deal with it, okay? And you have sleep disturbances as well. So again, it's both extremes. Either they would lose sleep or they would always sleep. I know someone who sleeps every day. Not every day, but throughout the day, they would just sleep, and then they would wake up for like 1 hour and then they would sleep again. And on the other spectrum, they would not sleep at all. So they would have tiredness or lack of energy. They would have increase or decrease in appetite. So makikita mo yan, kain ng kain, or they would not eat. Because some people, if they feel something, they would overcompensate with eating. Because, eating increases endorphin, diba? Sometimes, a lot of people, they find eating as a therapy, diba? Ang daming Pilipino dyan, like Tara. Right, Tara? Okay, Tara, if you're watching. Yeah, so, you would just eat or you would not eat. Yan, diba? Yan yung mga other symptoms. Anxiety, agitation. So, just going in a place and a lot of people, where there's a lot of people, they become agitated. Or they would go in a different, or in the mall, makikita mo na lang yan, parang takot na takot sila. So, those are some of the symptoms of depression, okay?
How about mild anxiety?
Suicidal thoughts. Yeah, that's actually a medical emergency. When I was in Baguio City, we were in a psychiatric ward. We automatically admit those people who have suicidal tendencies, suicidal thoughts. Kasi usually yung mga yan gusto na nilang mamatay, okay? Wala, because hopelessness, they do not see anything that's gonna change in their life. So, ano pa ba ang pag-asa ko? So that's why some of them, they would kill themselves. And unexplained physical problems, like headaches. Oh, gulat ka na lang, Mami, masakit ang ulo ko, ganyan. So they would feel personal pains, okay? So, without medical problems. So, magugulat ka na lang, may mga nararamdaman na sila. Wala naman silang problema medically. So, probably, it's also a symptom of depression. Yes, and it affects everybody. Even children. Even children can have depression. Old people, yan. Yan yung mga more common, okay? So, it affects mostly the young and the old, but also the middle age. So it affects everybody, but it affects more female, okay? More sa babae rather than sa lalaki, or at least because majority of the people that goes to the doctor are females. So we really do not know if male also would have the same amount of population that are affected by depression.
Just suffering in silence.
Yeah, they're just suffering in silence. I know a lot of males.
Oh yeah, I know a lot of guys, especially having come to the military, who are suffering from, symptoms of depression. But in order to seek help, often one is perceived as weak.
Yeah, okay. And when they kill themselves, most commonly the male would, if they would do suicidal thoughts, usually the male would succumb. Mostly it's all deadly. Mga babae naman, usually it's not deadly. Kasi kung tayo, medyo takot. Okay, so the risk factor includes low self-esteem. So usually depression is more common in people that have low self-esteem. Hindi ako masyado maganda, I'm not so beautiful, I'm not so intelligent. So makikita mo yan, okay? And they have undergone some traumatic events in their life, like a loss of loved one, a loss of their parents, or family member. So pwede din po na they went to war, okay? Those are traumatic events, or they lost their job, the more important job that they feel. So being homosexual increases the risk of depression as well, and history of mental illness. So if you already have a mental illness aside from depression, like psychiatric or schizophrenia, if you're already a schizophrenic person, so you would have a higher tendency of depression. Alcohol abuse, again, like what I said, and illness. If you have cancer, okay, so more or less you would have depression as well. Diba, nakikita niyo pagka if a person has cancer, or my dad had kidney disease. So he was depressed because he lost his eyesight, and he's a writer. Do you remember, honey, when he was very, very sick?
Yeah.
That's the first thing that, not really the first thing, but some of the things that happened to him. He lost his eyesight, and he was depressed afterwards.
Fantastic father-in-law, worst patient ever.
And also some types of medication. Some types of medication can predispose you to clinical depression.
Such as antidepressants.
Yes, such as antidepressants. Okay, so another causes of depression can be genetics, like what I said. So probably your mother, your father, they already have a history of clinical depression. So it also increases your risk of having depression in the future. And biochemically, in the brain, so you make your neurotransmitters. So another trivia for them.
Okay.
What is the neurotransmitter that makes you happy? Okay. So, if you watch Spice in Disguise, you will know the answer. So, what is a neurotransmitter that will make you happy? Okay, I think a lot of people know that. Yes, Sir Jock knows it. He's very intelligent. So, if you know the answer, please put it in the thread. Yes, Kat. No.
It's close enough.
It's close enough. Kat Agnes. Yes, Sean Krisha Testado. No, not Sean Krisha. Jean Lit Torres Pautong. Yes.
Cat Agnes was close enough.
Yeah, it's not, yeah.
It wasn't spelled perfectly.
Okay, so who won?
Cat Agnes.
So, Kat Agnes, you won. Okay, so Sir Jack said you won.
It was close enough.
It was close enough, but me, I would not. Just
No.
Okay.
Don't make them look up the spelling of serotonin.
But it's Sir Jack. Sir Jack is the one who's gonna tell you.
That's the first one I saw.
Yes, okay. So, Miss Kat Agnes, you won 5,000 pesos. It's serotonin. So, the serotonin, sometimes you have problems in the brain, right? So, probably, that's why you're depressed. It's because your serotonin is very low. Yes, Miss Adin Flores. So, there are a lot of things that you can do to lift up your clinical depression. One is food. Okay? So food, what are the foods that would make you happy? Diba? Happier. Usually fatty foods, they make you happier. So sometimes you remember, right? You eat nuts. They would tell you, oh, you eat nuts, you eat avocado, salmon. Yes, these are fatty foods and they can really help you with your mood. Okay, I think there was one diet back then, and they removed it was a low fat diet, and some of the people that are on a low fat diet, they are more depressed. Yeah, so because your brain is made up of cholesterol, literally you have a fat brain, okay? So it's around 20 to 30% cholesterol. So if you don't eat foods that are fatty, of course your brain will shrink. And this can help, okay? Another is you exercise, okay? Exercise increases your endorphins also. So there was an article that came out in Scientific American. I was just reading it last time, and they said that the chronic exercise or exercise like aerobic with some form of mental exercises like you're answering questions like in trivias like what we're doing or reading. So coupled with exercise, you do that both at the same time, it increases your hippocampus. So hippocampus is the part of your brain that is responsible for memories, okay? So it also increases that. So I think that's one of the best thing that you can do as well. You do your exercise and at the same time, you also do some mental exercises, okay? And it increases the neuroplasticity. So when you're connection, you make a lot of connections, okay? So have a hobby. Okay? So, baka mamaya, kailangan mo lang ng hobby, nalulungkot ka lang. So, you know, if you have a hobby, if you're preoccupied, then you don't have the opportunity to be sad. Diba?
Too busy.
Yeah, you're too busy. Diba? Okay. And do not isolate yourself. I think that's the worst thing that a depressed person does, right?
Yeah.
Kasi
normally they want to isolate themselves.
You want to isolate yourself.
But it's one of the worst things you can do.
Kasi diba, ayaw makipag-usap, diba? Pagka depressed ka, no. This is the time that you should be talking to people. even if you do not know anyone, I think you're gonna go there when you're walking in the mall. You know, just talk to people. Do not isolate yourself.
Hello.
Do not go in one place and just do nothing.
Just, I want to say
Talk to a lot of people.
A quick hello to Edith O'Duran in the merry old land of Oz.
Wow.
Australia, that is.
Oz, yes, in Australia.
Yeah, how was like reading books? You know, improving yourself. Because understand, when you can learn something new, it's a really wonderful thing for you. It can help to develop that neuroplasticity in our brain as opposed to watching, watching TV. You know, and that's not teaching us anything. It's just, you know, silliness.
Yeah, so I think that's, and even in the Bible it says that do not isolate yourself. So I think that's one of the most interesting that you can do for yourself. So again, for the vitamins, you can try serotonin. Okay, St. John's wort. It's a plant. It's very popular here in the US, and it's been used by a lot of depressed people. Lavender, chamomile, virgin coconut oil. Yes, so these are one of the things that you can eat or drink. Lemongrass, yan. So it calms you down. Another is manganese and magnesium. So these are just some
magnesium,
of the
big time.
Some of the multivitamins or the things that you can do for yourself if you're depressed. Okay.
So, in fact, another thing you can do to help beat depression is to win some cash.
Win some cash.
Win some cash, like right now. Right
now.
now. First person to answer this is the two-part question. You have two answers for this. So one answer is not going to get it done. You need to answer both in your answer. Okay. In what two animated Disney movies did Lea Salonga sing?
Okay.
In what two Disney animated movies did Lea Salonga sing?
Yeah, Lea Salonga. She's a good singer. I'm always watching her videos in YouTube, and Sir Jack is always upset. She's one of the greatest singer for me. Yes,
and I'm ready to take the snapshot of whoever gets this first. That's for 5,000 pesos.
So for those people who wants to win,
you have to answer both.
Yeah.
You have to answer both, not just one.
Movies,
two answers on your line, not just one.
Yes. Make sure.
Yang Toledo Viado.
Yes. Congratulations, Miss Yang Toledo Viado. Yes, you won. It's Mulan.
You won 5,000 pesos.
Yeah. Make sure that your spelling is right.
Close enough.
But close enough, sabi ni Sir Jack. Okay. So, that's good. Congratulations to you. Yes.
Mulan 1 and 2.
Farrah Bunch did not win.
She didn't sing in Mulan 2, did she?
No, she didn't. It's just Mulan 1. So, you did not win, Tara. Sorry. And then Jerry Min Lumbawi said A Whole New World and Reflection. Yeah, I really like that, A Whole New World. That's one of my favorite songs. And when my dad was alive, that was his favorite song. One of his favorite songs. Okay, so to end this, some of the complications of depression, if it's not resolved, that's why it's very important to resolve it, is premature death. Yeah, kasi magulat ka na lang, bigla na silang naman nagpakamatay. Diba? So that's why this is a medical emergency. Okay? And I think there should be no stigma with the depression because no one wants to have depression, diba? Sino ba naman ang gustong malungkot lagi? Yan. So, and another is self-mutilation. So, self-mutilation, makikita mo na lang yung sa kamay nila, diba? They would just cut themselves. Magugulat ka na lang, may mga cut na yan. So, because they are mutilating themselves, that's one of the complications of depression. Physical pain, weight loss, and weight gain. Those are the complications. Alcohol and drug abuse, okay? Because they do not know how to process their emotions, okay? This is what I told Jack, Sir Jack. Because if you see someone, you shouldn't be upset with them. Why are you so sad? You know, you should have to teach them how to process their emotions. I think that's one of the most important thing that you can do for them. And family conflicts, it can arise to family conflicts kasi diba pinag-uusapan nyo na lang mag-asawa as a husband and wife, you're just talking about it. So it can affect the family dynamics. So you would have conflicts that would arise because of depression. So it's very important. But again, as a family, this is for me, for our family, and this is what I always tell my husband and my children. We are a team. Okay? So if someone is weak, we have to help that person. And I think that's what family dynamics should be.
Good question here. Aiden Flores is asking, hi Doc, kung gusto niyo po na gumaling sa depression, does that mean I should not cry? Should I prevent myself from crying?
No, you should not prevent yourself from crying, okay? You should cry. If you wanna cry, just cry, okay? Again, like with sad, because these are emotions, okay? So if you feel this, if you restrain yourself from feeling the pain or from crying, baka mag-blow up ka, okay? You would have angry outbursts, okay? So it's better for you to just let it all out, okay? And another complication is social isolation. So people would think that person
Whatever
is a
happened to them?
weirdo. Yeah.
Whatever happened to that?
Diba? Kasi depressed ka. So, yung mga tao ngayon, iniisip, baka mamaya, you're crazy, okay? So, it's, the clinical depression results to social isolation. So, those are the complications of depression. And again, for all of you who are depressed, if you wanna, there's a lot of articles out there in the internet right now, so you can read it. This will help you. And for me, because I'm a Jehovah's Witness, you can visit jw.org. It's all there. There's a lot of article. You can read it and it will help you, okay? Those are scriptural based. So you can read it. It's all in the Bible to guide you. Okay? So I hope that I'm able to help you, Miss Adin Flores, about clinical depression. And it's something that you should not be upset or you should be ashamed of.
No,
or
ashamed of.
Yeah, ashamed of or be embarrassed, okay? So these are part of the things that we process. So this is part of our life. So there's you should not be upset about that. Okay. So any more questions?
I do have a question, actually. And the last name here is perfectly fine as far as this answer is concerned. And as long as your spelling is close, I will accept it.
Okay.
Unlike
me.
unlike this one over here who wants it exactly perfectly correct.
You are welcome, Miss Adin Flores. Yes.
Okay. In what U.S. president planted a tree in Tarlac province that is named after him?
Yes, this
What?
is in San Miguel. No,
You didn't say where it's at.
Yes, I'm gonna say
No,
where
you didn't
it
say where it's
is.
at. And employees are not eligible for this. So don't answer and give away the answer, huh? So what U.S. president planted a tree in Tarlac province that is named after him? Let's see here. Who's going to get this one for 5,000 pesos?
5,000 pesos. Who is a U.S. president? But that time he was not a U.S. president.
But he's a U.S. president. He was a U.S. president.
Ayaw magbigay ni Sir Jack ng another clue. So, it's a U.S. president. So, if you know that. Miss Lori Garcia, nakaka-depress talaga pag may sakit, Doc. Yes, you are right, Miss Lori Garcia. But do not isolate yourself. Talk to a lot of people, okay? Okay, so, yes. SS, no, it's not.
Nope, not Roosevelt. Nope,
No.
Not Obama.
So, RMG Babes to Bale, what is for myoma? For myoma, you can try Damong Maria po, that can help you.
Epi Roa. You
Yes,
are the winner.
Epi Roa. Wow, Dwight Eisenhower, not
That is-
Hover.
It's close enough.
Yes.
Dwight Eisenhower, you're correct, Epi Rosa.
Epi Roa, yes. How did you know the answer, Epi?
She may have spent some time in San Miguel.
Yeah. So, but you have to tell us the story, though.
Okay, the story is while he was still a colonel in the U.S. Army.
This was in what year?
I believe in 1939.
Okay, so
Either 1937 or
World
1939,
War-
prior to World War II.
Okay.
Colonel Dwight Eisenhower planted a tree at the Camp Cervellano Aquino base. I don't know if it was named that back then, which is known as the Eisenhower tree. It's called the Eisenhower tree. The sign there says the Eisenhower tree. Now, he became the Supreme Allied Commander during World War II and became a 5-star general, and then subsequently U.S. President during the 1950s.
Yeah. So, what is the tree? Do you know?
The Eisenhower tree.
No, there's no Eisenhower tree. I think it's an
No,
acacia.
it might be an acacia, but it's called the Eisenhower tree. It's
I
not.
think it's an acacia.
It's who
tree.
planted it.
Yes. Sir Jack is just upset because he doesn't know the tree.
I don't remember what it was. I just remember
Okay.
it was cool when we saw it.
This po. Hello po sa inyo. Yes. Chenilyn Chuli Chen General. Yeah, she's giving me an emoji, laughing and crying at the same time. Yeah. Okay. So, Mary Joy B. Olivero, no, hindi po si Theodore Roosevelt. Yeah. So, Erin Bancale, I have an ovarian cyst. Okay, for ovarian cyst, again, there are research that says it's a deficiency of silica. So, if you are familiar with the plant horsetail, so you can make it as a tea and then you drink it 3 times a day. So that can help you. Let me know if it helps you because I have not tried it. That research just came a couple of months ago. So please tell me if it works. Yes. So Miss Farrah Bunch again is saying, at least we can confirm I'm not fed the question. What did she say?
The questions or answers ahead of time.
Are ahead of time.
That is correct.
LOL.
And you are not eligible to win either, sister of mine.
So, Adele Papa, how about dermatographia? What's the best remedy? So, dermatographia, if you look at them, you can see, it's like if you have a sharp object and you do like this and you can see like if I draw on Sir Jack like a straight line, and there would be a wheel, okay, or an erythematous lesions on that. So that's dermatograph, yeah. So the remedy for that is you can use honey and cinnamon. You can drink that. That's very good for a lot of rashes, whatever rashes it is, even if it's a viral rash. Okay, or just dermatitis. So, honey and cinnamon is always a good thing to have. Yes. So, Lani Quales, ano po ba ang gamot sa anemia, Doc? Salamat po. For anemia, you have to eat green leafy vegetables, okay? Actually, almost all most plant, they are rich in iron, okay? And of course, you can eat meat. Okay, because they're rich in iron. Like me, I eat liver. Yan. So I eat liver because I'm also anemic. Molasses, yes, they can help you a lot. So, yeah. Next is, yes, Miss Glenda Katubig, mali po. So, Fela Lazaro, ano po ang gamot sa rhinitis? Yes. So, for all types of inflammation, what I do is that whatever inflammation it is, my first home remedy is honey and cinnamon. That's it. Honey has a great anti-inflammatory property as well as cinnamon.
Legit honey.
Yeah, legit honey. Yeah, because some of the honey right now, especially the honeybees, they are being fed with sugar. So that's gonna be one of the problems right now. Mahirap mabuhay sa mga times right now. Actually, there was one person I was talking to last time, and he was so frustrated because we were talking about genetically modified organisms, and he's trying to say, Doctora, what can I do? I mean, I want to eat outside, and I'm not 100% sure that the food that they are serving is not GMO. And I told them that the world is not perfect, okay? So we can always, what we can do is we can control some of the food, but not 100%. That's why it's very important to have detox, okay? And detoxification for me is one of the cornerstone of the Dr. Farrah protocol. So it's actually in my other book, my third book, how does the Dr. Farrah protocol works, and one of them is detoxification. So you constantly detoxify.
Which anybody that doesn't think that the body needs detoxification, or that you don't have a accumulation of persistent organic pollutants in the body, they're either not very well read on the subject, or they're simply denying it.
Well, the one who initiated the detoxification is Jehovah. Yeah, whether you like it or not. Because the thing is, he put in our body one of the largest detoxifying organs, which is our liver. So the liver is a detoxifying organ. Even our skin. So our skin is also a detoxifying organ. Also our lungs lungs and kidney, those are detoxification organs. So, because Jehovah knows, especially right now, we really need to detoxify. Okay, that's very important. And probably I can talk about detoxification in the future more in depth. Yes. So, someone is asking about anxiety. So, Madam, please review this FB Live. I have tackled it. Anxiety, depression, sadness. So, I have tackled most of them. So, you can look back again on this video, and then you can see for yourself what are the things that you can do for depression. Yes, what is the herbal cure for hyperparathyroidism? So, for hyperparathyroidism, you can use pixie dust here. Yes. Yeah. Kasi the problem with your hyperparathyroidism is that you have hypercalcemia. So mataas po yung calcium sa katawan because the parathyroid is the organs that is responsible for calcium metabolism. So yun po yung organs at the back of your thyroid glands. So there are 4, 1, 2, 3, 4. So you have 2 thyroid glands, and at the back of your thyroid gland is a parathyroid gland. They're very tiny. They're probably like this big. And when you do a thyroidectomy, usually you would remove the thyroid gland. So, and if you remove the parathyroid gland, you would have hypocalcemia. So, but if you have hyperparathyroidism, you have hypercalcemia. So your calcium is high. And increased calcium in the body would predispose to a lot of ailments like stones. You would have stones, kidney stones, gallbladder stones. Okay, so you would have seizure disorders as well. So, because calcium is very important for muscle contraction, so your muscle cannot contract without calcium. But if you have high calcium in the body, yes, so you can use magnesium, pixie dust. So, how do you take it? 1 teaspoon 3 times a day. Okay.
What do you suggest? A question from Ria Lisel Banzon Kaiko. What can you suggest for
myasthenia gravis? Myasthenia gravis, it's an autoimmune disease, okay? So, characterized by weakness. So, usually they would have weakness. So, if you're familiar with autoimmune diseases, so your body attacks your own body. And some of the causes, they do not know. They do not know, yun ang sabi nila. And some of the diseases that are like this are Sjorgen syndrome, so ankylosing spondylitis, and lupus, yan. So these are autoimmune diseases. But the myasthenia gravis is very special because it affects your central nervous system. So what you can do for me, I would advise you to drink Boston Sea, megadose vitamin C, and pixie dust. Now, if you're not able to do that, you may try ginger. Yeah, ginger is my anti-inflammatory drug. For me, the best anti-inflammatory drug out there.
No, it's a
Not
food.
Drug.
Not a drug, it's a food.
Anti-inflammatory herb out there. Yeah, ginger. And
you have to remember, Dr. Farrah's first language is not English.
No, it's not. It's Tagalog. Yeah, so I'm sorry if my English is not perfect. Yeah.
And yet you want people to spell perfectly.
So I'm sorry about that. Yeah.
How about endometrial CA?
Okay, so Gia P. Bengzon is asking about endometrial carcinoma. So for endometrial carcinoma, your uterus, so you have your linings, diba? So you have different linings. So you have your endometrial lining, which is mostly the part that is being shed. So it's always shedding every 18 days to 24 days, 29 days sometimes, 29 to 30 days for most people. And then you have your myometrium, which is the muscle layer of the uterus, and your parametrium, which is at the outside. So, or epimetrium. Yeah, so yun ang tawag nila. So these are the layers of the uterus. And then if you have some form of anomaly on the endometrial lining, okay, or some form of cancer there, endometrial cancer, they say, you would develop mass. Okay, so, and then sometimes bleeding, okay, bleeding outside of the menstrual cycle. So, or excessive bleeding during menstrual cycle. And you would also have obstruction. Sometimes you cannot pee or poop, or you're gonna have difficulty moving. So these are the most common symptoms. So what you can do again is you can try guayabano leaves, avocado leaves, yan. So ginger, garlic, adamong Maria, yan. Those are the herbs that you can try. And of course, Boston sea, mega dose vitamin C, and pixie dust.
Mm-hmm.
Yes! Okay.
What is the best time to take vitamin C, Boston C, and pixie dust, and Dr. Shaken how to take? Well, obviously take them as per the label instructions.
Yeah,
and take them after meals.
So there's a label here at the back. Okay. You may choose to follow that. That's okay, okay? Like with the Boston C, it says 1 teaspoon with water once daily, or as directed by a licensed healthcare professional. So you take it after meals. That's always important. Hello! Someone is, yes.
I want to wear some different pants.
What?
Okay, and go wear some different pants, son.
You go wear some different pants.
Okay.
Okay.
Mitch Domingo, sorry, that's a laundry list right there. What to do if you're diabetic, high cholesterol, and hyperacidic, candidate for hyperthyroidism?
Okay. So diabetes, cholesterol, and hyperacidity, you know that these are all lifestyle diseases, right? So that's the first thing to do. Do not panic. Do not panic. It's organic. Sir Jack says that. Okay, so do not panic. You change your diet. That's the first thing to do. So for me, diabetes, you should not be eating sugar or foods that are easily converted to sugar, such as simple carbohydrates like rice, bread, pasta, potatoes. So you shouldn't be eating that. You try ketogenic diet. I know some people, they said do not eat it, you know, there's some side effects on it. But I have used it for a long time, and as far as I know, I'm healthy. I used it and I'm very skinny. Not skinny, I'm very healthy. I don't have any illnesses, and I have given it to some people. I have suggested that diet, and it helped a lot of people as well.
Mm-hmm.
So what you can do also with with hyperacidity also, wag ka na kumain ng spicy food, yeah, if you're hyperacidic. And high cholesterol, again, there's a lot of research that says that the higher the cholesterol, the longer you live. I know. There are so many studies right now that comes out, and they're pro-cholesterol. And you have to understand your body is made up of cholesterol, and if you eat foods that are low in cholesterol, your body will make its own cholesterol. That's how important cholesterol is.
Well, the science clearly demonstrates that cholesterol is associated with longevity, not mortality.
Yes. So if you eat your brain, again, it's made up of cholesterol. Your body, the one that makes your hormones, the precursor is cholesterol. Your cell membrane is made up of cholesterol. So it's very important to have a healthy level of cholesterol. Again, so for hyperthyroidism, you should eat cabbage juice if you wanna try it. Cabbage juice, it will help you with hyperthyroidism. Okay, so the plants that can help you: guayabano leaves, avocado leaves, garlic, ginger, and damong Maria. So they can help you. Chromium for your diabetes, it can help you. Magnesium, of course, that's my favorite, one of my favorite, magnesium. That can also help you with your hyperacidity. I have one of the worst GERD that I know of. The worst was my dad.
Oh, he was bad.
My dad had a bad case of GERD. He would
He'd burp
like every
6 times a minute.
Yeah, so because of his diabetes. So the problem is you have diabetes, so you also have diabetic gastropathy. So it affects your gastric lining. So not gastric lining, but the lining of your gastrointestinal tract. So you would have problem.
Lizelle Marcelo Paduga says, hi, Dr. Farrah. What can I do for mom? She's 68 years old and has non-small cell lung cancer. What are some things she may try?
Okay, you may try asparagus, yes, guyabano leaves.
Guyabano leaves.
Yes, so you can try that. Garlic, ginger, of course. So, you know, if you look at the research about garlic and ginger, they're actually one of the most researched herbs.
Mm-hmm.
Yeah, and I think garlic has hundreds of research.
Thousands.
Yeah, hundreds and thousands, because I was reading it. It's very effective for cancer and a lot of lifestyle diseases. So you might want to try that. Okay?
And, you know, obviously we've had a significant number of people in the past who, just by coincidence, taking Boston C, megadose vitamin C, and Pixidas magnesium, have seen a return to health in a situation like that, just by coincidence.
Yes. So Gilbert Quito, hello po Doc Farrah, watching po from Saudi Arabia. And Carlos Garcia, wanna win, please. Okay, so before we stop, okay, I wanna ask, do you want me to ask the trivia or you wanna ask one trivia first?
I can ask.
Okay, you ask a trivia. Sir Jack, last question.
Your last, so Carlos Garcia, you better be ready. All right, this is for 5,000 pesos. And you need, this is a 2-word answer, and you need to have them both correct. For what musical did Lea Salonga win a Tony Award?
Whoa! I think a lot of Filipino knows that.
They should know that. That's why this is easy. It's gonna come down to who can type really fast.
Let's see. Yes. Leilani is asking, the Mung Mariati are effective for PCOS or pregnant easily? So it may help. But if you're pregnant, do not take the Mung Maria because it's an abortifacient. So do not take the Mung Maria if you are... Yes! Ang galing-galing naman!
Ao Pangan Martillo.
Woohoo!
You are correct. Miss Saigon.
Yes! So she's very happy. Jana Ganzan, Baklaan, hello po from Singapore. Yeah. I don't know what's happening with Hong Kong. Yeah. I want to go see Hong Kong again.
So Alpangan Martillo, you won 5,000 pesos.
Karen Ann Boyer, you did not win. I'm so sorry. Lenny Alvarez Bartolay, yes, you're right, but you did not win as well.
It has to be the first one, and
Yes,
that's why I
one.
take pictures of these.
Okay, so that's it, honey. We're
No,
gonna
just
go, yeah.
give a few more Q&A, Mama.
Okay, so how many bones?
Oh no,
Does
not
it-
more trivia.
I thought you
No,
said-
not more trivia.
Okay.
More Q&A.
Q&A, okay. I thought
These
it
wonderful
was...
people have. You want to hear about the new product coming? Yeah. So basically, it's lightning in a bottle. Now that's lightning, as in lightning that shoots out of the sky, not lightening. It's a fantastic, high, powerful multivitamin that basically we're coming out with, which is also superfood formula. So not only are you getting a broad spectrum multivitamin complex, which basically completes so many things, but it's also includes the density of 4 servings of fruits and vegetables per dose. So it's awesome. And it'll be arriving today?
Yes.
Yeah, it'll be...
Nahuli ka na, Josper. Huli ka na. You're late.
You're late,
Yes.
Jasper.
So, Debbie de Los Santos, hello Doc, I always try to catch your FB. Yes, you did not catch it. You're late also.
You are late.
Edith Odoran, hello po from South Australia. Yes.
Yeah,
So
she
Karen
didn't ask
Ann
that
Boyer
question.
answered it.
No, but you didn't ask that question.
Yeah, okay. But she's good though, yeah. I don't know if Karen Ann, are you a nurse or maybe you're a doctor also or what? Yes. So yeah, so they answered it already.
People just throwing out answers now.
I think we should, yes. So thank you very much for watching. And
Anything else,
yeah,
Mom?
no, that's
Just
it.
thank you everyone for a really great 2019. We're looking forward to the new decade,
Yes.
starting here in just a couple of days. And we really appreciate your support. You know, it's been a difficult year and a half or so, you know, since we were illegally closed in the Philippines. But you bounced back big time, Mama. You're doing wonderful. You're helping a lot of people. You know, so that's really, really great. And so I appreciate, you know, getting the opportunity to be your husband.
Okay.
I appreciate you.
I appreciate you.
Well, thank you,
Okay.
Mama.
Bye.